Welcome to Module 2, where we will cover patient selection and the clinical performance of non-invasive prenatal screening. Placental cell-free DNA is present in the maternal circulation from 4 to 5 weeks of pregnancy. However, it isn't until 10 weeks gestation that there are adequate quantities of cell-free DNA for NIPT. In addition, an ultrasound scan is required to confirm gestation prior to NIPT screening. How is an NIPT screening result calculated? The a priori risk is the maternal age risk for trisomy, or the first trimester combined test result, if it is available. This is then modified by the risk generated by the cell-free DNA analysis to calculate a final result. The NIPT test is given as a risk score. In the NHS, a risk score of 1 in 150 or greater is used as the cutoff for a high-risk screening result. It is best practice to refer to risk as chance when speaking with expectant parents. What are the advantages of NIPT over traditional screening? They are numerous, but the key facts show that NIPT is safer, faster and more accurate than other screening methods. NIPT reduces the number of false positive results, thereby reducing the number of unnecessary invasive tests. And what are the disadvantages of NIPT? Although it has a greater than 99% detection rate, NIPT is still a screening test and is not diagnostic. This is because NIPT cannot differentiate between DNA from the placenta or fetus. In the presence of combined placental mosaicism, NIPT screening could show a false positive result. There is also a small chance of a test failure, and a redraw may be required. Next, we will look at which patients are suitable for NIPT and those that are not. NIPT can be used in singleton and twin pregnancies. In monochorionic twins, the sensitivity and specificity is as for singleton pregnancy. But in dichorionic diamniotic twins, the sensitivity and specificity are reduced to 95%. NIPT cannot be used in higher order multiple pregnancies like triplets or quads. NIPT screening is suitable for IVF, egg donor and surrogate pregnancies. The SAFE test uses the age of the egg donor at the point of donation to give the most accurate screening result. This ensures an accurate and individualised risk result for egg donation and surrogacy pregnancies. NIPT will not work in cases where a maternal trisomy is present or if the mother has cancer, as malignant tumours shed cell-free DNA fragments and it can affect an NIPT result. NIPT is also not advised in women that have had a blood transfusion within the past 3 months. Transfused blood in the circulation could potentially affect an NIPT result due to exogenous transfused DNA remaining in the circulation. In addition, NIPT is not suitable for individuals who have had transplant surgery or immunotherapy. There may be a small chance of cell-free DNA circulating from the donor which can affect the NIPT result.